Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about colorectal cancer prevention and diagnosis. We're going to take a look from the family practice level all the way down to integrative oncology. So we'll start first with Dr. Gabrielle Givens, who's our first guest. Good morning.
Good morning.
Dr. Givens, I know that you are a family practice specialist and you work with St. Tammany Physicians Network, but tell me a little bit about your background.
I'm actually originally from Washington Parish, and I did my family medicine training with LSU, and I've been with St. Tammany for about a year and a half now.
Fantastic. Well, I'm sure you're as glad as the rest of us that we seem to be getting that pandemic behind us.
Absolutely.
And putting our focus on taking care of people. And of course, in family practice, your focus is very much on that, taking care of the whole family from very young to very old. Mm-hmm. And cancer diagnosis, I think, is a big piece of that. Mm-hmm. So can you talk a little bit about the role primary care plays in wellness screenings?
Mm-hmm. Primary care plays a really important role in wellness screenings. You know, we're the first point of contact for patients. We are responsible for their wellness exams, and that's what makes those wellness exams so important, is because that's an opportunity for us to talk with patients about what preventative health screenings are appropriate for them.
Okay, so if you think about it from our topic today, colon cancer, in your patient population, who's eligible for, because everybody doesn't need a colon cancer screening. So
right.
Who are we talking about?
So all adults over the age of 45 are actually eligible for colorectal cancer screening. I know that people typically think age 50 is, you know, that's when I get my colonoscopy, but they actually recently updated the guidelines to age 45. So now all adults over age 45 are now eligible. And we typically continue that screening until at least age 75.
Okay, so from 45 to 75, men and women, so that's really a pretty broad population of people. So colon cancer, I think, I know that for women, breast cancer is the most common, and for men, prostate. But when you take the whole adult population as a whole, colon cancer is the most common.
Correct.
And obviously, if the only risk factors we're going to say are you 45 years old and breathing? Okay, we need to screen. And we have a tendency to jump straight to colonoscopy, but there actually are a few ways that we can screen for colon cancer.
There's a couple different options. Colonoscopy is what typically people think of when they think of colorectal cancer screening. Now that's done by the gastroenterologist under anesthesia. It's both diagnostic and therapeutic, because if they find a polyp, they're actually able to take that during the procedure. Now, there are some non-invasive options for colon cancer screening. One is the FIT testing. It's not quite as accurate as a colonoscopy, but still a very good test. And the interval for that screening is actually yearly. And then there's also another at-home test that we use frequently, Cologuard. People have probably seen the commercials, those types of things. And the interval for that is actually 3 years. And you're able to do that in the comfort of your own home.
Very good. And so FIT testing, Cologuard, and colonoscopy, three completely different types of screenings. And you said FIT test annually, Cologuard about every 3.
Every 3.
And if you do a colonoscopy, that's once every 5?
So it actually depends on if they do find any polyps. If they don't find any polyps and it's a negative colonoscopy, you could be good for 10 years, which is nice for the patients.
Wow. Oh, that's fantastic.
Yeah. So it's on a patient-by-patient basis once they've done the colonoscopy.
That's really interesting. And I guess, like I said, most people, when you say colon cancer screening, they immediately think colonoscopy. And maybe there's a really good reason for that. If you're clear for 10 years or even 5 years if they find something. And the idea that having found something, they can take care of it right there on the spot.
Absolutely.
That's really exciting. So we talked a little bit there about what kinds of screenings we would do. But those are all proactive things that you as a family practitioner are going to say, you know, I come in for my annual, I feel fabulous, nothing's wrong with me. And you go, yes, but you're over 45 and female, so let's get, you know, these screenings done. What symptoms might someone be experiencing that would send them to come in and say, I'm kind of worried there's, symptoms of colon cancer. What are those?
Yes, so there's several symptoms of colon cancer. Some of the more common ones are changes in your bowel habits, or if you notice a discoloration or blood in the stool. Things like that should definitely prompt you to go see your primary care provider and discuss those with them.
Absolutely, because those could be colon cancer, but they could be a host of other things.
Correct.
Which is exactly why family practice is such a great place to start.
Absolutely.
Okay, and I think certainly we always talk about genetics in cancer, and in colon cancer in particular. So can you talk a little bit about that?
Yes, a patient's genetics are actually really important when it comes to colorectal cancer screening, in addition to, prevention. So if you have a family history of colon cancer, that does put you at an increased risk. Now, there are also hereditary forms of colon cancer. And so it's important not only to know what age the family member was when the cancer was diagnosed, but also what type of cancer it was, because depending on what type and age, we may need to start screening earlier.
Okay, so when you're doing annual physicals and wellness visits with your patient population, you're looking at things like that. So how old is my patient, male or female, what's their background? And then you ask that history.
Correct.
Because that helps you to know if my mother had colon cancer or my grandmother had colon cancer. Those are things that tell you something about what my risks are.
Yes. That's why I ask every patient when they come in for their wellness visit, is there a family history of colon cancer? Even if they're 18, I want to know, is there a family history? What age do we need to start your screening process?
Wow. Well, and I guess that brings up an interesting point about family practice. So talk a little bit about your patient population. Most doctors who are specialized are looking at a very discrete section of our population. But as a family practitioner, you see everybody.
I know. So I actually see ages 2 and up. So I take care of pretty much all ages, all the way up into your 90s and above. So, and that's what I like so much about family practice, is I get to see a little bit of everybody and everything. And my favorite thing is to actually take care of families. So I have several families where I take care of several generations, which makes family practice really interesting and fun for me.
I'm just thinking about that, not just from your family practice standpoint, but our topic today, colorectal cancer. If you're taking care of a family, then you're getting a family history that's really rich and very informed.
Correct.
And so from those risk factors, you are able to really know a lot about when to screen and what to watch for.
I know. I do have a bit of an advantage taking care of families in that way, is because if one of the other family members is diagnosed with a new diagnosis, I know that that now is a risk for one of my other patients. So a little bit of an advantage in family medicine there.
I love that. And so as a family practitioner in St. Tammany Physicians Network, that enables you to take all of that information that you're helping that family with and use all the resources of this largest health system in West St. Tammany, so that when you do have someone who needs colorectal cancer care, they have all the resources they need in your own system.
They do. It's so nice working in this system because we have great help from the specialist, and it just really makes it easy for our patients to get the care that they need.
I love that. Well, Dr. Givens, thank you for coming in.
Thank you.
It's been a pleasure to have you on the show.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about colorectal health, and up next, we'll learn about specialty care and integrative oncology. We'll be right back.
Here at St. Tammany Health System, we're empowering our mothers, our sisters, and our daughters like never before. Throughout our entire system, we've invested in the highest level of technology available to provide more accurate diagnostics, less invasive care, and faster recoveries. Together with our partner, Ochsner Health, we're giving women many ways to live stronger and better.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about colorectal health. We're looking at prevention, diagnosis, and treatment of cancer. We looked at the family practice level in our first segment, and next we'll be diving into specialty care. I have as our next guest Dr. Suma Satti. She's a hematology oncology specialist at St. Tammany Cancer Center, a campus of Ochsner Medical Center. Welcome to the show.
Thanks for having me.
Dr. Satti, so tell us a little bit about your background to start.
So I have worked at main campus Ochsner for since 2008, trained and did my fellowship there, and stayed on because I fell in love with the city. And recently I've started coming to the North Shore, and I really, really like my experience here. I've been serving as vice chair. We have started some special programs up here, which would be like a multidisciplinary program. I know you're going to talk about it in a little bit, but we have a multidisciplinary approach to cancer care, and we'll dwell more into it. But that's just the best way to do oncology, and it just gives me excitement to bring that to this part of this
Fantastic. Well, I know you're right. I do want to talk multidisciplinary because I think it's just a game changer in cancer care.
Yeah.
But if you can just start off with the role that your specialty, hematology oncology, plays in a colorectal cancer diagnosis.
Yeah. So we do see patients after their diagnosis most of the time. Sometimes we see them because they have anemia and they end up with iron deficiency, and they get referred to us for that, and then we end up finding the colon cancer. Because anyone with an iron deficiency anemia should have a colonoscopy after a certain age.
Oh, wow. Okay, so someone may just be experiencing anemia, have no idea that what they have is cancer, and in the process of trying to treat that anemia,
sometimes we diagnose cancer as a cause.
Oh my word. Boy,
Yes.
Cancer is serious business, and I'm so grateful there are people in these industries and in these areas of medicine that just have this knowledge, and we've coalesced them together in the Cancer Center. So I think if you can talk a little bit about the sort of treatments that are available, you know, once that diagnosis happens.
Yeah. So if you're talking colorectal in this segment, basically when they get diagnosed, most of the time they end up seeing a colorectal surgeon, unless the cancer is spread at the time of diagnosis. Colon and rectal, we're talking both. So it depends on the location of the tumor, whether it's in the colon or the rectum. They get referred to a colorectal surgeon, a medical oncologist, and a radiation oncologist. Radiation oncologist is usually for the rectal cancer diagnosis. So that's where the multidisciplinary care comes into place, where we review all these new cases and decide what's the best treatment approach for them. So we are a group of doctors who sit together and do only colorectal that whole hour. And then we have a multidisciplinary clinic where we see the patients in the same setting. So whoever the patient needs to be seen gets seen. So that's how we do it, so that we save time for the patient and also get the things done, get the ball rolling quickly for the patient.
That's what I'm thinking from that multidisciplinary team standpoint. When you all meet for your multidisciplinary team hour, you're focused on specific patients, specific cases.
Yes.
And you're sharing those, and you have radiation oncology, hematology oncology, medical oncology, you have surgeons, you have every area that might need to care for that patient.
Correct.
Looking at that individual human being's case.
Right.
And figuring out among our areas of specialty, these are the things we need to do for this patient.
Correct. And we also have pathology, radiology, nurse navigators, social workers, research, everyone on that meeting.
That's fantastic.
So we can look at each case, we review the case, we present the case, and we tell all the information that's available, review radiology, review pathology, and then decide, okay, this is what we would recommend for the patient. So they're all recommendations. It's not like anyone is forced to do anything. This is just recommendation with everyone sitting together who do colorectal cancer for a living, basically.
Right. And so all of those colorectal cancer specialists are bringing their area of specialty into the room and focusing together and making a recommendation. But then when you talk about the multidisciplinary clinic,
Correct.
that's a step beyond the meeting.
Correct.
Because you're talking about these areas of specialty actually being available to the patient
Correct.
in a same day or in a really
Correct.
tight couple of days,
Yeah.
so that you are speeding up those second opinions and the visits
Yeah,
even.
I think you hit the nail on the spot. So basically, when patients get a diagnosis, there's always this time that is lost trying to find a cancer doctor, then trying to find a surgeon, then trying to find, there's weeks and weeks go by. And oftentimes we see 6 weeks, 8 weeks has gone by, and what could have been an early cancer can become advanced in that time. So we don't want that to happen, because cure rates are higher if it's an early cancer, and it's an advanced cancer, it can be incurable, and sometimes Cancer doesn't read a textbook, so it can grow fast. So the advantage of a multi-D clinic is we are there. All 3 people that are involved in colorectal cancer are there. The navigators know what days those are, and navigators are the people that navigate patients through the system. That's their job. So their job is to make that patient who has a positive colonoscopy come in, see the colorectal surgeon. If it is advanced, they set it up with a medical oncologist. If it is rectal, automatically you get a radiation oncology opinion. So what we try to do by doing that is we're all there, so we can see the patient one after the other. So the patient gets all the opinions and the treatments start rolling. So you're not having this 2 weeks or 3 weeks or 4 weeks lag period in taking care of the patient.
Oh my goodness, that is fascinating.
It is. It works well.
And I think when you realize that all of that is available in St. Tammany Cancer Center, a campus of Ochsner Medical Center, that those partners have pulled that level of specialty together into
Correct.
that one place.
Yes.
And as you're saying, if you're not experiencing that kind of coordination, then you're kind of your own navigator, and you
Yes.
need to find yourself a surgeon, and you need to find yourself a radiation oncologist, and you need to find yourself a hematology oncology specialist. And you've got to try to coordinate your care, and that sounds a little bit overwhelming.
It is very overwhelming for the patient. Plus, the patients are not supposed to be doing that. You know, we have to take care of the patient. You know, that's our job. So having that system integrated makes a big difference for them. You know, you have, and they're all their records. They have everything at their fingertips. So they have a question, they don't understand something. They can see my note. As soon as I sign it off, it'll show up in their in-basket. They can see the scans, they can see the labs. They have everything at their fingertips, so they don't have to go around looking for things. It can be very overwhelming with a diagnosis like that.
I love that. That's Epic, or my chart that you're talking about, that the patient themselves can see what's in there.
Yes.
And every specialist on the case can see that
Correct.
information.
Correct.
And I think, along with the multidisciplinary team, the other thing that I think is hugely important about working with a large organization like St. Tammany and Ochsner is clinical trials.
It's absolutely.
So can you talk a little bit about what's available through our cancer center?
Yeah, we have tons of trials available, and we decide during the tumor board what the patient qualifies for also. So the research nurses are part of the tumor board. So we, when we do the multi-D tumor board, the research nurses are also in there with their list of trials, and they screen the population before and say, hey, we think this patient qualifies for this, what do you think? Because the trials, there are so many of them, they come and go, so we want to be at the cutting edge. So we include the research nurse on the board, tumor board, so that if we see something and we think the patient qualifies, we evaluate and we project that information to the patient. And obviously we're not making the patient sign up for something if they don't want to do it. It's completely voluntary. So we tell them, hey, this is the standard of care that we would do. This is the trial. Why is this better? Why would you do this? Things like that. Because we want to give them cutting edge treatment. We want to be able to work with the patient to decide what they want to do.
That's fantastic. And so you're able to connect them with clinical trials from almost anywhere.
Correct.
And so they wouldn't have to travel.
Correct.
They'd be able to be under your care close to home.
Yeah, and we are actually trying to expand more on the North Shore. We do have, obviously, South Shore has a bigger research thing,
Sure.
and North Shore is a little bit smaller, but obviously we are smaller compared to the South Shore. But our goal is to open up more trials over here so patients don't even have to travel across the lake.
Well, and if you do have to travel across the lake, that's not having to go to Houston. It's
No,
not
it's
having to
not.
go to Baton Rouge. It's just
not.
across the lake.
Exactly. And trials are like so important nowadays with the way the oncology is running. Literally, it's running. Every day we get a new approval. Every day we get a new indication. So if the doctors are not staying up on cutting edge and patients are not given those options, you're not really going to make progress in that field.
Got it. Dr. Satti, thank you so much for coming in.
you.
This is fascinating.
Thanks for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. We'll be right back.
The North Shore has always marched to the beat of its own drum, and the cardiology team at St. Tammany Health System has always stayed in rhythm with the community we love so much. Here, many talented specialists and subspecialists devote themselves to providing minimally invasive cardiac surgery and the latest advancements in cardiac disease prevention. Together with our partner Ochsner Health, we're making St. Tammany hearts beat stronger.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about colorectal cancer, treatment and diagnosis. We looked from the perspective of family practice and then delved into specialty care at St. Tammany Cancer Center. And next, we're going to hear from Rene'e Christman, nurse practitioner, about integrative oncology at St. Tammany Cancer Center, a campus of Ochsner Medical Center. Rene'e, welcome.
Thank you.
So excited to have you here. And integrative oncology, I know, is relatively new, and we're pretty out there on the forefront bringing it to the North Shore. And I've had a few people talk with us about it, but I'd love for you to talk a little bit about your background in integrative oncology, and then let's tie it to colorectal cancer.
Sure. Well, my background, I've worked with St. Tammany since 2011, and I went to school at Loyola, and I have trained with Dr. Elizabeth LaPere over at the Benson Cancer Center.
Fantastic. And Dr. LaPere actually is a previous guest to the show. She was who introduced us to integrative oncology in the first place. So that is wonderful. So if you can talk a little bit about where integrative oncology comes in. It's usually after diagnosis. Someone knows they have colorectal cancer, they've had some treatment, and they're faced with some issues, and that integrative oncology is going to be supportive. Isn't that right?
Yes. We focus on quality of life and symptom management. So patients can come and see me anywhere from the minute they get diagnosed, they can come, all the way through if they've had no evidence of disease for 10 years. They can still come and see us down there.
Okay, so it probably is then symptom driven.
Yes.
So can you talk a little bit about what kind of symptoms people will experience that maybe make integrative oncology a good choice?
Yes. So with colorectal cancer, there's always the psychosocial side and the physical side. So physical side, colorectal cancer, bowel and bladder incontinence, body image, sexual health plays a big part. So whether patients are getting surgery, chemo, radiation, those different treatments will sometimes cause different types of problems. So anytime anybody gets radiated to the pelvic area, that can cause sexual pain, painful intercourse. It can cause bowel and bladder incontinence. So we address everything head to toe. Diarrhea is another problem. Anxiety, depression. All of those things that come along with, one, getting a new cancer diagnosis, and then two, going through all of those treatments.
Right, and while we're trying to make things better, some of the treatments we have to do are going to create these symptoms that make you feel terrible. Yes. And so integrative oncology really can help with the management of those symptoms.
Exactly.
So maybe talk a little bit about what some of those treatments are.
Sure. So we are really proud of all the things we have to offer for our patients. So we have classes, yoga, tai chi, meditation, and music therapy. And all of those classes are free for our patients that come to see us. Yes, and the only requirement is a cancer diagnosis. You can be in active treatment, you can have just found out you had cancer, or you can be no evidence of disease and live in your life, and you can still come see us if you have any of those side effects that can be a little longer lasting.
Wow. And so, at the beginning of the show, we were talking with Dr. Givens as a family practitioner about trying to screen and be proactive and find things early. And then if there is a diagnosis, to help that person bridge into treatment. And then Dr. Satti and I were talking about once we know we have a diagnosis, then we're putting all of those specialists together in the multidisciplinary team, and they're very focused on how they're going to eradicate that cancer, how they're going to help that person get past this disease. Mm-hmm. But you and your partners in the integrative oncology discipline, you're part of that as well.
Yes, I joke and I tell my patients that, and I guess it's really not a joke, I think I have the best job in the cancer center. Patients come to me and we get to make a plan on how to make them feel better.
That's wonderful.
So when you were asking about what services we also have acupuncture and physical therapy and speech therapy. So those play a huge role. Acupuncture, especially for patients that are in active treatment, good for neuropathy pain, any kind of pain really, fatigue. It can help with stress and anxiety. So that's a really important part of what we do down there, and we're really proud of it, along with our dietitians. So if a patient's having a lot of diarrhea or they had bowel surgery, they can't eat the same things they were eating before, right?
Oh, right.
So we have a good 1 hour appointment to really go through everything, find out what's going on with these patients, and then I can send them to the dietitian. We can send them to physical therapy or to acupuncture. We have fabulous oncology psychologists that we work with. So that's another avenue that we can go for patients.
Gosh, and all of those things through St. Tammany Cancer Center, a campus of Ochsner Medical Center, which is right there on Highway 21 at I-12 and Ochsner Boulevard. I'm just kind of wowed by the idea that, you know, Dr. Satti and I were talking about with the multidisciplinary team, that you don't have that situation where a patient is trying to find their own, who can do my surgery, where is radiation oncology available to me, and maybe spending weeks, you know, losing time doing those things, that all of those specialists are available in the cancer center. But you're saying within integrative oncology at the cancer center, in addition to all of those treatment modalities, we've also got this aspect of how are we going to help you to manage those symptoms, to feel better, to reduce nausea. And I love the idea of a dietitian helping you. I mean, I think I'm a healthy person and I'd like a dietitian to just help me figure out how I should be eating. But, you know, cancer is serious business, and here you are with this colon cancer diagnosis, and you're going through this treatment and you're managing your pain. And integrative oncology is going to say, well, let's get you some acupuncture for the pain, and let's get you some physical therapy so that you can work on your balance and all the things that have been knocked off kilter. And let's get a dietitian who can help you understand what you can and can't eat and how to make that palatable and enjoy the foods you can have.
Exactly. You know, we don't want patients to go through this treatment. You just say, beat cancer. Well, then you're not having a good quality of life. So we want to kind of put the whole thing together. We want you to go through your treatment. We want to reduce those side effects as much as we can. And then we want you to have a good quality of life, both during treatment and after treatment.
And that after treatment, that's really the exciting part. We get focused on trying to cure the cancer and get somebody over their cancer active disease, get them into remission, recovery, survivorship. And in integrative oncology, that's a continued relationship, isn't it?
Yes, yes. We can keep seeing patients. We can see patients that come from primary care. Maybe they've been a survivor for 10 years and they're still having some lingering side effects. We can keep on helping these people.
So there's not really a finite end to a cancer patient's relationship with the integrative oncology specialists.
Correct. Correct. And that's so wonderful. I mean, I've had patients that I'm now on the 3rd time seeing them. And then I've had patients that we say, you know what, you're doing really well. Let's just follow up as needed. And sometimes I'll say, oh no, I want to come back again in 6 months. I'm like, okay, that's fine
great.
too. But yeah, it's not a relationship that has to end because you're not maybe seeing an oncologist or radiation, getting radiation or something at our cancer center.
That is fantastic.
Yeah.
Rene'e, thank you so much for coming in to talk to us about integrative oncology.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we talk today about colorectal cancer, prevention, diagnosis, and treatment. We hope you'll join us again for a future episode of Healthy Living.